Hello, everyone. Welcome to Gift of Health podcast. This is Dr. Arjun Raipudi, and this is my lovely wife, Dr. Shobha Raipudi. We are both lifestyle medicine doctors and co founders of Gift of Health. Today, we have a very special guest.
And we are very excited to bring this guest. So welcome Dr. Soham Patel, and he's a very dear friend of ours, and we are so glad today he's with us.
Dr.
But
Patel is a triple board certified. He's a triple board certified. He's board certified in internal medicine, diabetes, endocrinology, and metabolism, and also lifestyle medicine. So it's a
it's an honor
it's an
to
honor to have this chat with you, Soham. Dr. Patel did his residency training at University of Tennessee, Knoxville, and he's currently practicing at Center for Preventive Endocrinology in Tampa. And we are so excited to have him here. And so I'm so glad you're here.
so Soham, can you tell us like where do you live and what type of medical practice do you have?
Sure. So, Arjun and Shobha, thank you, both of you, for inviting me to this session. In today's time, everything is virtual and online, so I have quite a few things to learn from you guys on those aspects. But I have my own practice, as Arjun mentioned, Center for Preventive Endocrinology and Nutrition. I'm in Wesley Chapel, which is a northern suburb of Tampa. And I use endocrinology, but also heavily use the principles of lifestyle medicine in addressing the chronic lifestyle diseases that we see, like type 2 diabetes, high blood pressure, high cholesterol, a lot of thyroid problems, osteoporosis. So I'm not against medications, but I don't use medications as my only form of therapy. I use lifestyle choices and modifications as equally important aspect of my treatment plans with patients. And I find that when we use the power of both, we tend to have better health and a chance of lowering medications and improving health at the same time, and not just keeping on piling more and more medications. Some of my quite drastic changes have been getting people off insulin with type 2 diabetes and gearing them towards reversing their type 2 diabetes. And with thyroid, Hashimoto's is a type of thyroid disease which affects the thyroid, leading to underactivity, making it not function as well. That, if you address it early on, it has a lot of benefits in helping prevent and reverse. But the overactive aspect of thyroid disease, which is Graves' disease, that responds very well. And I have quite a few patients in my practice who have been able to come off medications and normalize their thyroid function with lifestyle changes. So that's what my passion is, and quite satisfying to be able to get people off medications and feel better.
That is so awesome. And our listeners are really eager to like hear about because like yeah, they have questions about okay, can lifestyle changes really help like some of the common things that you have mentioned, like whether it is diabetes or hypothyroidism or if it is Graves' disease or hyperactive thyroid. So they're all eager to hear from you like what can be done. But Soham, what inspired you to be a lifestyle medicine doctor? Like, as we see, you are certified in internal medicine, endocrinology, but like, what inspired you to move towards lifestyle medicine?
I think the inspiration came from my maternal grandfather. He was a civil engineer by training, and he worked as a engineer for almost 40 years in the government back in India. But after retiring, he invested, and even while he was working, he was a lot into naturopathy. So he, for most of his adult life, was eating a lot of raw, pretty much vegan foods. Um, And he was able to defy his family history. His elder brother died of heart disease in his 60s. His father passed away from heart attack in his 70s. His nephew had a stroke in his 40s. But he lived to be 84 and quite active, 84 years of life. I remember at the age of 77, and I was 22, 23, he beat me going up and coming down the Tybee Lighthouse. There's a lighthouse at and off of Tybee Island in Georgia, and that's where he used to. He lived quite a few years, and he beat me to that 177 spiral steps up to the top, uh, being 3 times older than me. So that showed a lot of proof. And he would talk about Dr. Barnard's work and Dr. Joel Furman and Dr. Ornish, and so those seeds were already in my head, but somehow I ignored the message about dairy. I was an avid dairy person consuming 3 glasses of milk and a pound of yogurt every day, literally. So by the time I entered my endocrine fellowship at UAB, um, we had time to look into research topics, and so I started looking up the research on nutrition, and that's when it started piling up, and I realized that I could not keep ignoring it anymore. So I stopped having my milk and yogurt. um, I stopped it overnight actually, but within 3 weeks I lost 20 pounds just like that. And so I started back up a little bit of yogurt again, plain Chobani yogurt for lunch for a week. I gained back 5 pounds. Then I stopped again, it came off again. So that was quite a drastic change and happening so fast. And um, that propelled me further to keep digging further. And then that's when I started using more, impact on plant-based nutrition with my patients while I was in my second year of fellowship. And over time that has consolidated further, because what we find is just adding more medications is not the answer. I mean, I have seen patients with insulin, diabetes patients on insulin, on a type of insulin called U500 insulin. So it's usual types of insulin. For every ml of insulin there are 100 units. That's the concentration. But U500 means there is 500 units of insulin in an ml of insulin. So it's 5 times more concentrated.
Concentrated.
And I've had patients who, using U500 insulin, are getting close to 900 units of insulin a day. In a
Wow.
single day, they're getting 600 to 900 units of insulin. And they still can get their A1C below 10 because all they are eating is crap. And when you can get them to make lifestyle changes, you can easily start getting them off insulin faster, or even reduce the amount very effectively before they can start getting them. You can get them off insulin. And even with patients with type 1 diabetes, type 1 diabetes is where you do not make insulin, so you need insulin, there is no doubt there. But over time, patients with type 1 diabetes, when they keep eating low carb, high fat, high protein type of foods, they keep piling weight and they need more insulin, and they don't feel well and their sugars are starting to run high. When they start eating more whole plant foods like vegetables, fruits, beans, and whole grains, although they are consuming more carbohydrates but loaded with fiber, they start losing excess weight. Their insulin requirement drops by close to 50%, sometimes even more, and they feel better. So the idea is to work on reversing something that is quite commonly heard nowadays, which is called insulin resistance. And we'll talk more, as we go through this session. But I think the key process to reverse is insulin resistance. And if we can achieve that, then there are a lot of diseases which see benefits. So that includes type 2 diabetes, PCOS, hypertension, high cholesterol, even a lot of thyroid problems, different types of autoimmune conditions. So it's a common pathway to a lot of disease, and if we can work on improving that, that does help a lot. So that's how my journey has gone. And then obviously we got in touch with the each other through the lifestyle College of Lifestyle Medicine, and we took our board certifications last year, which was interesting journey. But every day I keep doing it, I find more and more transformations with my patients, and that keeps me going.
That's wonderful. You had an amazing start. Like it's wonderful to have some seeds sown at that, like what you shared with your grandfather. That's amazing. And since you already mentioned this insulin resistance thing, can we just touch upon that? Like, because that seems to be the cornerstone or the hallmark for many of the diseases that we are seeing, right? Type 2 diabetes and PCOS, as you mentioned. Could you explain it to our listeners? What is
Sure.
this insulin resistance, and what can we do about it?
So in very simple terms, our body makes insulin. There are specialized types of cells called the beta cells, which in the pancreas that are have the unique capability to produce insulin. And half of the insulin that our pancreas produces is taken up by the liver, and the remaining half goes through the muscles in the body and rest of the tissues. But a big chunk, 50%, is taken up by the liver. And predominantly, one of the functions of that insulin is to shut off the glucose production by the liver at night uh, above a certain amount. The liver does make some glucose at night when we are not eating, so that our brain gets a steady supply of glucose. But typically, with diabetes, normal person would make 1 gram of glucose per hour from the liver. With diabetes, you usually see that going up to 5 to 6 grams of glucose being made by liver every hour and being dumped into the bloodstream. And so that's happening because of insulin resistance. So when the insulin is taken up by the liver, it goes attaches on the surface of the liver cells. So think of this as my hand as an insulin receptor, and this as insulin. And so when this binding happens, there are a lot of enzymes under the surface of that receptor inside the cell, which have to, chemical reactions happen, which in turn leads to these channels of glucose, transporter channels, which are floating around inside the cell to plug up into the cell wall. So once that channels plug up into the cell wall, glucose can enter the cell and be utilized to generate energy. That is how normally insulin would work. Now, what insulin resistance means is that insulin is binding on the receptor, but the cycling and the signaling of the reactions that should happen inside the cell, it is not happening because of buildup of fat in the liver cells. So when anybody is consuming a lot of food and a lot of calories, or they're consuming food that is high in fat and animal protein, it starts building up fat inside the liver cells and animal protein. Both of those things can trigger reactions which blocks that signaling inside the insulin receptor. So the channels that are supposed to plug up into the cell wall, allowing glucose to enter, does not happen. So the sugar stays in the bloodstream, which the pancreas senses that and produces more insulin to compensate. This is initial stages. So initial stages, when your body makes more insulin, it can compensate that blockage. But if you do not change the way you're eating, the buildup of fat and protein keeps getting worse and worse. And you reach a point where your body is making maximum amount of insulin that it can make, but it is not doing what it's supposed to do when it binds to the liver cell. Now, buildup of all that fat in the liver now starts spreading to other organs. So there is a molecule called triglycerides, which is the fat in the bloodstream, that starts going to the muscle cells, to the beta cells in the pancreas that make insulin, and it starts doing deposition of fat in those cells as well, and they start having the same issue. The insulin doesn't work like it should, so it stays in the bloodstream and it's not taken up by the muscle cells and the liver cells. And the third effect that happens is more buildup of fat in the beta cells that make insulin actually lowers their ability to make insulin. So you're getting a double whammy. You are not getting the effect that you should get from the insulin on the liver and the muscle cells, which is allowing the glucose to enter and be utilized. And you're also affecting the production of insulin from the pancreas. And studies show that if you can lower just 2 grams of fat from your pancreas, if you can reduce the pancreatic fat deposition by 2 grams, you can reverse insulin resistance.
Wow. That's just 2 grams from
Yeah.
pancreas.
Yeah. And
So to lose 2 grams of fat in the pancreas, you have to lose about 15 pounds of body weight. Fat.
Yeah, that's a good number to have. Like, that's
Yeah.
something that gives a hope to our listeners and now patients and clients. Just if you work for that 15%, 15-pound weight loss, that you will start to reverse insulin resistance. So
but
just to
but like some people think, okay, I don't have much weight to lose. I'm lean, but why do I have diabetes or insulin resistance?
So that actually leads us to this other type of diabetes. So clinically, type 1 and type 2, everybody knows, but there are actually more types. And the one that has lately gained more recognition is type 1.5, or latent autoimmune diabetes of adulthood, LADA as we call it. So what happens is through an autoimmune mechanism where your immune system is attacking your pancreas, like what would happen with type 1 diabetes, you lose the ability to make insulin to a large extent. But you're not completely having zero insulin like type 1 diabetes. You still make maybe 2-5% insulin. So you don't go into that ketoacidosis state like happens with the type 1 diabetes, but you're not making enough insulin that would support normal blood sugars. So for someone who is very lean or muscular build and they're still diagnosed with diabetes in their third, fourth, or fifth decade of life, they should be checked for something called the C peptide, which is the protein that beta cells make. And that works as a marker of how much insulin your body is making. So typically you will find the C peptide levels to be low, not zero like type 1 diabetes, but low. And their sugars are running high if they just take any oral tablets. So they typically have to be on insulin regimen. But if they follow whole food plant-based way of eating, they can keep the insulin requirements to the very minimum, like a type 1 diabetic person can do, and still get better health. And then you will find some people who are not this type 1.5, they are type 2, but they don't have fat in other places, especially people with Indian ancestry. We only deposit fat in the visceral area, in the tummy. So we may not have a lot of fat other places, but because we have more fat deposition in the middle of the body, any visceral or fat around our abdominal organs can easily lead to insulin resistance. So if you can get rid of that excess abdominal fat, then that can help you reverse insulin resistance.
That's a beautiful, explanation, Soham. Like, if I may summarize what is the insulin resistance is basically the excess deposition of fat that is coming through either diet or that's already there, and this excess fat is clogging up the function, clogging up in the cells and outside the cells, and it's getting in the way of insulin doing its job. So the body is making insulin, but it's not able to do its job, right? And you're saying that even in type 1.5 diabetes, it's also there is a component of insulin resistance along with some autoimmune process going on.
Yeah, so if you have type 1.5, and you are put on insulin. Let's say they recognize you have type 1 and have, and you do need insulin, oral medications would not suffice. But if you keep following the same advice that you get commonly, is eat less carb and more fat and protein, you can develop secondary insulin resistance like a type 1 diabetic. So you could end up in the same situation like a type 1 diabetic, needing more and more insulin. And so if you change the way you're eating, you can limit the amount of insulin requirements you need and keep sugars more steady. And so I have typically patients who go from eating 50 grams of carbohydrates a day to eating 200 or 300, sometimes 400 grams of complex carbohydrates a day, and still needing 50% of the insulin that they were needing before.
That's actually the contrary to what the advice that is being given to them most of the time, isn't it?
Yes, like a lot of people are afraid to eat carbohydrates when they're diagnosed with diabetes.
Can you clear some confusion? Yeah, carbophobia, right? The
Yes,
fear of carbohydrates. Can you clear some confusion? Can you throw some light on what is this carbohydrate phobia, and what should we be eating when if you're diagnosed with type 2 diabetes or type 1 diabetes?
So carbohydrates are the fuel for our body. If you think about it, 20% of the whole glucose that the body goes through is only consumed by the brain. Brain is such a metabolically active organ that 20% of all the glucose that we consume or we process is taken up by the brain. And the brain only likes glucose. It can use ketones if it doesn't have glucose, but the primary fuel source is glucose. And that's the same for the kidney cells. They only like glucose. That's the same for red blood cells. They only like glucose. So glucose is something that the body needs, and that's what the fuel is for. Because if you go into some geeky stuff with biochemistry, still keeping it simple, there's a process called the Krebs cycle. And in that, if you have one molecule of glucose pass through that cycle, it generates 38 molecules of ATP, which is, think of it as a energy currency of the body, right? We use dollars or whatever the currency is to do transactions in our life. Any reaction that happens in the body requires energy, and the energy is supplied by that ATP molecule. So that's our body's energy currency. So one molecule of glucose can generate 38 molecules of ATP, but if you have one molecule of fat going through that same process, it can only generate 8 to 10 molecules of ATP. So clearly, glucose oxidation is a more efficient way of generating energy. Our body can use fat if it doesn't have access to glucose, like would happen if someone is fasting or doesn't have access to food and is going through starvation. Then the body will break down fat. But we like glucose. Now the question is, what source of glucose do we rely on? Simple carbohydrates or refined carbohydrates, like things, refined flours and simple sugars, cookies, candies, cakes, pasta, that are highly like refined flour based, or complex carbohydrates that comes with a lot of fiber, like fruits, vegetables, beans, whole grains. Because of the fiber content in those foods, the glucose breakdown doesn't happen very fast. It happens in a very gradual, sustained manner. So your body gets a steady supply of glucose in the bloodstream after digestion, which all the tissues can utilize in a good, effective manner. But if you get a dump of glucose from refined and simple carbohydrates like cookies, candies, cakes, those kind of stuff, then you get a huge spike. And a deadly combination is if you have simple carbohydrates combined with fat, example being pizza. So you have white flour, refined flour, a lot of it in the dough, and you top it off with meat and cheese. You have the perfect storm, so to speak, that can really cause your sugars to spike up, because you have simple carbohydrates in a high load without much fiber, and you have the fat which actually works against the processing of that carbohydrate. So you get a huge spike something very similar, not although at the same extent, but I find people doing is eating fruit with cheese. They will have cottage cheese or cheese with some grapes.
Mm,
Again, if you eat grapes by itself, the sugar response is a lot lower, versus if you combine it with cheese, you get a lot bigger spike.
mm. That's something that many of our clients don't recognize, how cheese and chicken and meats can contribute to making diabetes worse, isn't it? Like,
Yeah.
do you see that in your practice as well? Like, how much confusion is there what to eat when
every
we
day
when
every day I have it takes me quite a bit of time to, and every visit I may have to keep reinforcing, because that carbophobia is so ingrained in our thinking from what we hear in the media, and so-called you know fitness experts who many times they may have right information, but the amount of information out there, there's a lot of misinformation, and anybody, even with a medical background, we have to look through
Mm,
studies and not look at the flash versus the
yeah.
headline, but look in the detail and see what's really going on. So it's quite challenging for people to discern what's good science versus bad, and that leads to status quo or just follow what's being told. So it is very common. But the magic number, if we talk about, is we want to limit the total caloric intake in form of fat per day under 15%. But if we are dealing with a disease state like high blood pressure, high cholesterol, type 2 diabetes, or insulin resistance at the core of it, then limiting the total fat to around 10% of daily intake
Mm,
really helps us get that healing process going.
mm,
So one easy way is to use that chronometer app
Mhm.
mm,
and change the settings where you keep the fat percentage as 10%,
mhm,
then plugging in everything you eat for a week, 10 days, and you'll really be surprised that even if you may be eating plant-based,
mm.
you may find the oils and all the different things could easily ramp up that 10%. And another thing is that people may end up trapping is processed plant foods.
Mm.
Mm,
Eating a processed vegan burger is not much healthy than the actual burger, although it may be better for the environment. But you don't want to eat better for the environment and end up hurting your own health in the process. So it could be used as a transition, but relying on more processed plant foods is not going to get you to better health.
that's a wonderful point. Like, that's actually a trap that we see
Mm.
many of the people who try to transition to eating plant-based, and leaning towards more processed plant-based foods, like the breads and pastas and pizzas and cookies, donuts, and all the processed plant foods. Like, you also mentioned about the oils, right? And so what do you notice, like, when it comes to oils? Like, how does it affect the the whole diabetes process and the overall health?
So oil will have the same similar effect like any type of fats will have, but the added disadvantage with oils is it's also high in free radicals for
Mm,
most of the oils. Now, you can say a high quality avocado oil or olive oil will have polyphenols and new antioxidants, but again, it's completely processed form. It has 100% fat. Whereas if you eat an avocado or if you eat
Olive.
olives, it has the fiber. You still
mm,
get a better combination of things. But if you take any type of those oils, they all have a lower smoking point.
mm,
So when you heat them up, they start getting rancid. They start creating more free radicals.
mm,
So even a good oil compared to other ones, again, I'm not promoting oil, but if you had a comparison, you took a high quality oil, but when you heat it up, you make it bad.
mm,
If you are, let's say you're Italian and you have a cultural inclination, or that's what you've been grown up eating, I would rather have it as a flavor with some things than drench everything with olive oil or cook in a lot of olive oil, because you are creating more free radicals and you're not getting any benefit out of it, because it can still cause more insulin resistance. And I would still prefer eating olives in my salad than drenching everything with olive oil, or having maybe half an avocado 2-3 times a week to get some healthy fats. So healthy fats good, but
Mm.
not in form of processed oils, because one, you have too many free radicals. Second, you can pack in more calories
Mm.
easily in a smaller volume. And thirdly, it would still worsen insulin resistance.
So basically, go for the whole plant fats like olives or avocados rather than going for
Yeah.
processed liquid fats like
Yeah,
oils.
same with coconut.
Hmm.
There's a lot of demand for coconut oil now. Again, it does have 14 to 16% medium chain fatty acids, which are processed in a better manner, but still has close to 80-85% saturated fat.
Mm.
So I would rather eat it. I get the coconut meat, the shreds of
Yeah.
coconut
Yeah.
that we use heavily in making chutneys and things like
Mhm.
that, and eat it in a wholesome form than rely on pure coconut oil. I would use coconut oil as my moisturizer, not
Yeah.
to feed myself.
While we're on this topic, I also want to touch upon, when we are dealing with our Indian families and like, friends and all the patients coming from the Indian origin, there is a lot of attachment to the dairy products. Like as you also shared with your personal experience, and we felt the same too when we learned about this plant-based nutrition and when we were switching to whole foods, that like changing from eating a lot of dairy on a regular basis to
Yeah.
switching to non-dairy options. How does this, how do you explain these things to your patients, and what kind of suggestions do you give how to get over this dairy,
Yeah.
almost like addiction, dairy culture?
It is because there is casomorphins in it, which actually gives us that connection to dopamine spurts, where we
Mm.
want to go back to that. So that's a huge topic. But number one, I share them my own transformation. So because people connect to stories, so
Yes.
I talk about that. And secondly, I mean, my forefathers, were farmers. My grandfather also did a lot of farming in addition to different other enterprises. And I like doing, a lot of yard work, but I'm not doing anywhere near the amount of physical labor that my great grandfather or my grandfather did. And so their intake of dairy was a small percentage, less than 5% of their total, food. And the amount of physical labor they did was way higher. Their life was more simple. They didn't stay up late at night. Sundown, they went to bed. They woke up before sun rose. Stresses were a lot less than what we have now, where they didn't have exposure to alcohol and all the other toxins. So when you take that, and now you have more dairy intake, it's close to 20-30%. You're not eating the traditional foods anymore, vegetables and beans and lentils and whole grains, which were focused a lot in the way I at least grew up. My nieces and nephews don't like those foods. They want to eat all this processed and Western foods. Physical activity has gone down. Sleep issues have changed. A lot of blue light exposure that we have now. Stresses have gone up. There is a lot more alcohol and tobacco exposure now. So we are not comparing apple with apple when we say, oh, my forefathers were eating dairy, why should I not eat them? Life has changed. So if you were saying that you had some dairy sporadically, maybe once a week or something, a little bit of ghee here and there as a flavor, that is a whole different thing than saying I'm going to put a spoon of ghee in everything I eat, or I have a lot of milk. So that if the amount of dairy intake is high, then you will see the effects. And the biggest effect is your microbiome. So I'll share another brief snippet of my transformation. So 3 months after I had stopped having dairy. I was at a friend's house, and they made a dessert called, we call it fruit salad, but it's actually thick cream and milk with a lot of fruits and sugar.
Mm.
And so I can actually go through bowls of those, and whenever we would make it, I would keep having it for 2 3 days till I finished the whole thing. So I was tempted to have a bowl of that, and I was up all night with belching and nausea, almost puked, diarrhea, because my microbiome had changed in 3 months of not having dairy. My microbiome had completely changed. So something that I used to have all the time, I could not handle it in just 3 months.
Mm.
And that's the beauty of this change is microbiome, the bacteria that we carry in our gut, which is trillions of bacteria. If they are not the right kind and the right health, we don't have the right health. So when you avoid dairy, you actually start transforming your microbiome to have more variety and better quality. So the argument that you'll get is, so you should eat yogurt, right? Yogurt has probiotics.
Yeah.
Well, yogurt does have lactobacillus and different probiotics, but it doesn't, it still has casein and the high fat, which actually doesn't allow those bacteria to grow and multiply. So you may eat yogurt, which in comparison to other dairy foods is a better thing. But if you compare in absolutes, it's still not the best thing because it is not going to give you a better microbiome health.
Mm.
You will have a better microbiome health if you provided more fiber from the fruits, vegetables, and beans, and avoided the yogurt, and maybe had some fermented foods like some pickles, or in Gujarati cuisine there is an item called hanvo, which is fermented batter from lentil flour and rice flour, and then you bake it with spices. So every tradition has some form of fermented food. So if you have those, like sauerkraut is quite common here in North America. So sauerkraut, kimchi is a Korean fermented food. So having some form of fermented food in your routine is good to get the probiotics, but don't rely on the yogurt to get the fermentation.
Mm.
That's an excellent point you said, Soham. And even people wonder, okay, like I need dairy for my calcium, and especially when diagnosed with osteoporosis, one common myth is like, if I want to decrease my risk of osteoporosis, I should be drinking milk. So
So
what
that's the lie that I was also fed, and I believed in it for a good 30 years. And that's actually the point that I kept denying. When my grandfather kept talking about this for at least 10 years before I finally let it crack through my head. The point that I kept defending him with is, oh, I need calcium, so I need to get my dairy. But as I started looking more, I realized that was not true. So number one, any animal food, and even dairy, milk or cheese or yogurt, is acidic. The body's pH is 7.3, 7.4. We are a bit alkaline. And dairy is anywhere from 6.5 to 6.7. So it's definitely acidic. So when you consume acidic foods, your body has to use a buffer mechanism to maintain the pH. And there is something called bicarb or base, which is used initially, but that's very limited. So as soon as that runs out, the body has to then rely on calcium as a strong buffer to balance the pH. And 99% of the calcium is in the bones. So guess where your calcium is coming from to buffer all that acid? Your bones are actually losing calcium when you consume more acidic foods. So soda, which is phosphoric acid, and dairy, which is again acidic, those are two big things that can really cause a lot of calcium loss from your bones because of the acidity.
Mm.
And if you look at the World Health Study, um, World Health Organization study looking at dairy consumption and rates of osteoporosis, the countries which have higher dairy consumption actually have higher rates of osteoporosis. Now, there are some confounders and critiques of the study. It's not a perfect study, but calcium is only one part of bone health. You
Mm.
need good amount of plant protein, which again, animal protein is more acidic, meaning more work for the kidneys and more acid. So plant protein coming from beans and vegetables is necessary. Calcium coming from alkaline sources, which is leafy greens and beans and fruits, will actually lower your calcium loss in the urine, because you're not needing as much calcium to buffer. Your body doesn't excrete as much calcium. So if your
Mm.
calcium loss in the urine is low, you don't need as much calcium to maintain good bone health. And you also need boron, which is found plenty in prunes. You also need a magnesium for good bone health. And you also need the right activity to maintain that constant remodeling of exercise. So Dr. Lauren Fishman, he's a physical medical rehab doctor up in New York. And he was also a student of yoga from BKS Iyengar back in the
Mm.
70s. And so he designed a yoga protocol for 12 minutes every day, which he studied in a trial where patients improved their bone density without any medications by doing those 12 minutes of different yoga asanas.
Mm.
Getting the right strength remodeling on the bones and the tendons, getting alkaline foods and calcium through alkaline forms, avoiding the acidic foods, and getting enough magnesium, boron, um, and those type of minerals to improve your bone health. That's where, and enough vitamin D and K2.
Mm.
Vitamin D and K2 deficiency is quite prevalent. Not as much with K2, but vitamin D definitely. And so when you have enough vitamin D levels, you have enough exercise and remodeling happening because of that, strength training, and avoiding acidic foods and getting calcium in alkaline sources. Those are things which will improve your bone health.
Yeah, those are excellent points, Soham. Yes, so like getting our calcium from our alkaline sources and getting plant proteins instead of animal protein and having exercise and getting the vitamin D, it really improves our bone health. So
I
we
just want to ask one question on that. So I'm like, do you recommend any particular foods for getting enough magnesium from plant foods, whole plant foods?
So, obviously beans have magnesium, but I think a better source is yams,
Mm-hmm.
baked or
Sweet
boiled
potatoes,
sweet
yeah.
potatoes. They're
Mm-hmm.
loaded with magnesium.
Mm-hmm.
So that's a great source
Mm-hmm.
of, and then a lot of different fruits have variety, varying amounts of magnesium. But sweet potatoes I find are good for, insulin resistance because of the phytonutrients and the fiber. So
Mm-hmm.
it really helps lower the, glucose response, and it's also loaded with magnesium. So having that as part of your weekly meals is good.
Mm.
If you're not getting enough, then having a magnesium supplement in form of a magnesium gluconate or a glycinate,
Mm-hmm.
not the oxide or citrates. The oxide or the citrates can cause a lot of diarrhea,
Mm-hmm.
but the magnesium gluconate or glycinate would help actually improve your sleep quality because it helps relax muscles, and it will get you the needed
Mm.
magnesium if you're not getting enough through the food sources.
So
So
the bottom
yams
line
are,
is you can get magnesium from good amount of magnesium from plant sources, right?
yes.
Yeah.
Yeah, you
So
don't have to
I also have a
supplement, but
question.
you don't have to supplement. You can get
Yeah.
it from food, but if you need to add a notch, then you can use that
Mhm.
supplement.
There is this one question that has come from many of our students or the clients is, can have you seen cases or is it osteoporosis? Can you reverse osteoporosis? Like if you follow these recommendations?
So, as I said, I think reversal would not be the right word, but you
Mm.
can improve your bone density
Okay.
and the tensile strength of your bones.
Mm.
Because when you look at a bone density test, uh, now they are working on special imaging techniques which combine 3D imaging. So it actually gives you a better idea of the bone architecture compared to just a 2D image from an X-ray, which is what the bone density does. Um, so that's still evolving, but I think the idea is to improve not just the density but the strength of the
Mm.
bones.
Yes.
And even if you can maintain, like I said, there was a small trial done by Dr. Fishman where they actually saw improvement in bone density
Mm.
and reduced risk of fractures. So that's the goal, is you may not go back to normal bone density what you had when you were 30 years old.
Mm.
Your peak bone density is by the age 30, but you can actually maintain a good amount of bone density and not keep having further loss by combining those food, vitamin D, K2, a proper exercise and strength training, and getting enough of the different essential minerals. So it's not about going back to completely normal bone density, but it's about maintaining the bone density and improving the tensile strength of your bones, so that you don't. Bottom line is, you don't want to get a fracture. That's
Mhm.
the bottom line, right?
Yes.
You don't want to get a fracture.
Yes.
So just numerically improving the bone density may not necessarily translate into improving strength,
Mm.
because if you have arthritis around the joints, you could increase your bone density on a scan if you have arthritis changes, but
Mm.
that doesn't give you protection against fractures. So the idea is to improve the tensile strength of the bones, and not just focus on the bone density numbers. The density numbers, if they stay steady or improve, that's good, but your strength of the bones should be good, that you don't break a bone if you fall.
Wonderful.
That's
That's
an excellent point, Soham. Thank you. This is really very helpful for the listeners. So, Soham, can you speak on to what foods cause hypothyroidisms? Like, are there certain foods that increase
Sure.
our chance of?
So there are certain foods and things in our environment which definitely are causing more hypothyroidism. But I'm also seeing a lot bigger trend of people with type 2 diabetes or insulin resistance, which starts messing up with your thyroid signaling. So I've had
Mhm.
people who don't have Hashimoto's, which is the autoimmune process that leads to underactive thyroid. But just because they are diabetic and they have high degree of insulin resistance, consistently within a few years of diabetes they end up with thyroid problems, and now they are on a thyroid medication. So that's coming because of insulin resistance messing up with the signaling of other hormones, because we
Mm.
are not designed to be exposed to high levels of insulin 24/7.
Hmm.
We need insulin when we eat, but then it should go down. But
Mm.
right now it's staying high for a longer time, and that starts causing issues with other hormones. So you start getting issues with thyroid, with or sex hormones, and same thing with happens with cortisol. High cortisol levels from stress can also mess up with insulin and thyroid signaling. So that's one other aspect of why we are seeing issues with thyroid, which again, if you improve insulin resistance, then it will improve your thyroid function. The other big chunk of thyroid issues comes from food and environmental factors. So food, dairy is number one,
Mm.
milk, cheese, yogurt, butter. Processed foods with a lot of preservatives and food dyes and colors and things that we don't even know how to pronounce.
Mm.
Those are bad for the thyroid. And gluten.
Mm.
Now, gluten, which is protein found in wheat and some amount in rye and barley, has been used for ages throughout humanity. But in the last 50, 60 years, the way wheat is grown, it has been hybridized too much. So there is higher gluten content, and there is also a lot of pesticides being used. So those pesticides are causing issues with leaky gut. So now you have bigger protein molecules like gluten entering the gut lymphatics and affecting the immune system, and cause a lot of antibodies and immune reaction to the thyroid, and that causes a lot of thyroid problems, and it can also cause a lot of arthritis problems like autoimmune arthritis. And then fourth, we also get a lot of chemicals called flame retardants. Now, those
Mm.
flame retardants are chemicals used in color, paint, and furniture to prevent from catching fire. But there's a lot of halides and bromides in it, and those have similar structure to iodine. So it actually competes with iodine for the thyroid, and that also leads to a lot of thyroid problems. Fifth, we have a lot of exposure to radiation, X-ray radiation in the atmosphere, electromagnetic field radiation from laptops and computers. We spend so much time on the phone talking to people. So we get a lot of EMF radiation, microwaves. That is also causing a lot of thyroid problems. And lastly, the amount of pesticides, that also causes a lot of thyroid problems. So together, and then actually two more things. Low vitamin D causes immune imbalances, which leads to more thyroid problems. And lack of enough selenium can also lead to thyroid problems. So I actually recommend my thyroid patients to eat one Brazil nut a day.
One Brazil nut, yeah.
Get enough selenium
Mhm.
and optimize their vitamin D levels. And as I mentioned earlier, with Graves' disease,
Mhm.
which is the overactive aspect, those patients, if they start following a whole plant food based way of eating and optimize their vitamin D and take one Brazil nut a day, they typically respond in a matter of few months. And I have to take them off their methimazole and their levels get back to normal. With Hashimoto's or the hypothyroid aspect, if you catch it early on when the changes are still very early, within a few months or a couple of years, and you still have enough of thyroid glands preserved, you can reverse it. But if it has been 10, 15, 20 years of having underactive thyroid and a lot of inflammation, and your thyroid gland has been completely destroyed from that inflammation, then it is not practically possible to come off the thyroid medication. You may be able to reduce the dose if your weight gets better, but to completely come off the thyroid medication in that situation with destroyed thyroid gland after 10-15 years would not be possible. But on the contrary, right, I mentioned earlier with that insulin resistance, if someone has had insulin resistance, that is the cause of their underactive thyroid. If you can reverse their insulin resistance, then you can get their thyroid number back to normal.
So what I'm hearing, Soham, is it's pretty much there is so much of cross things between the insulin resistance, diabetes, and hypothyroidism. Just like what you mentioned for diabetes reversal, or like improving diabetes, if we just stick with whole plant-based foods, it seems like, along with when we manage other things, the hypothyroidism also, there is a decent chance it might respond.
Yes.
In our experience, like we had a few of our students in our the online the program, the Gift of Health program, where they came for other issues. I say other issues for like arthritis or diabetes or heart disease, and they were adopting whole food plant-based way of eating for that. But while they were doing that, those conditions were getting better. We had recently a couple of people who were able to lower their thyroid medications uh, as their health improved, even though they were on these medications, thyroid medications, for over 15, 20 years. They didn't completely come off, but as you mentioned, they were able to reduce the dose.
Yeah. Yeah. As I said, there's a lot of interplay and cross of many different factors. So if you can improve insulin resistance, the aspect of thyroid problems that could be coming from that would definitely go away. So you can reduce the dose, and if it was completely because of insulin resistance, then you can come off of it. But if there is a component of thyroid damage happening from inflammation from before, then you may not be able to completely come off, but at least get a dose to a better range. And get better health. People's arthritis and joint pain gets better, they feel better, they're not as inflamed. So there are a lot of improvements overall, even if you're not completely able to come off the medication.
Yeah. So some of our viewers have questions since you mentioned about gluten. So should we avoid gluten if it's one of the risk factor for thyroid?
So as I said, you don't have to be a cavalier or be so much fanatic about gluten that you stress about it, which makes things worse. You don't want to stress. Uh, but trying to make a conscious effort to limit the amount of gluten as much as you can. I think it's better because of the way wheat is grown.
Mm.
I have patients who, when they are in US, they cannot handle gluten, but if they go to Europe, they can have a piece of bread and not have the same issues which they get if they are here. So I think in general, limiting the amount of gluten uh, for anybody is a good idea to lower inflammation from the gut. Um, but you don't have to be stressing about it so much that you go bonkers about it. But someone who has Hashimoto's, I think those people should make a more conscious effort to limit the gluten and avoid it if they can.
Yeah. Sometimes the way we put so like we say there are major villains and there are minor villains in the story. The major villains the major culprits you want to take care of are the meats and the dairy products and the oils, and then
Processed
gluten.
foods.
Would you say that gluten can be in the minor villain section?
Yeah, for most people it will be a minor villain. For
Hmm.
some people it could be a major villain, like
Major villain.
Hashimoto's, it could be a major villain. But
Hmm.
for most people it's a minor one. So if you are trying to pick which one to start with, then gluten is obviously lower down the list.
Hmm. Well, so we can keep going with you. It's
I
been
mean,
such a fun
yes.
conversation.
Yeah.
And we really like your cute smile. And you see on the top, you have peacock on the back.
Yeah, I got this painting. I
Yeah.
like peacocks, and it
Yes.
was a nice painting. I actually have a similar one in my clinic office. So this is my home office.
Oh, beautiful.
But yeah.
Well, thank you so much for spending time with us, Soham. For our listeners, how can they get in touch with you? Like, could you?
Yeah, so my website, which I think you guys can put in too, is
Mhm.
Yeah, sure.
https // cfpen.org, which stands for Center for Preventive Endocrinology Nutrition.org.
Mhm.
And you can email me or call us on the clinic number. And if I can do medical coaching for anybody who is outside the state of Florida. I cannot provide medical advice because I don't hold medical licenses for other states or Canada. But I can definitely share my experience if you need that on a one-on-one basis. For anybody who is in Florida, I can definitely see them in office and help them make a change and be their endocrinologist and lifestyle physician
Oh.
combination.
Yes.
Thank you so much,
Yes,
Soham.
this was such a treat, and our viewers are really delighted to have you, and they're thanking you for such lovely information. Like this was a great session.
And we can't wait for you to come back and share more with us.
Yes.
Yeah, as I said, I look up to you guys on how you have created this whole program and keeping on evolving it. So you guys are my role model to be able to work on replicate some version of that down here. So, and I'll be happy to rejoin you guys in the future. But yes, I think rather than doing a PowerPoint presentation where people doze off, and this interaction is a lot easier way to keep engaged.
Mhm.
But thank you for the invite, and I look forward to future engagements.
Oh, thank
Thank
you
you.
so much.